This is me Arzu here and I welcome you to my channel Mrteeth, where your dental concept get dissected. And this is our first video of the pulp, and in this chapter we will be discussing with the pulp every aspects of the pulp. Okay, so but in this part, so this is the first part of the pulp. So in this part we will be discussing with the small introduction to the about the pulp, and after that we will discuss with the coronal pulp, radicular pulp, apical foramen, accessory canals, and the histological zones of the pulp. Okay, and this histological zones of the pulp, this is one of the most important subtopic under this chapter pulp. So many times they can ask in the theory exam. Okay, so they are mostly asking in the theory exam, so write a short note on these histological zones of the pulp. Okay, so you should prepare this subtopic well, very well. So without delaying much, let's get started. So as I have written here, pulp, it is developed from the dental follicle or the dental sac. Okay, so as I have discussed in the previous video of the development of the tooth, there I have discussed that what is this dental follicle and the dental sac. Okay, so once watch that video, then you will be clear in this concept, dental follicle or the dental sac. Okay, so pulp, they are developed from the dental follicle or the dental sac, and after that, as I have written here, it is richly vascularized connective tissue of the mesodermal in origin. Okay, so it is a vascularized connective tissue. Okay, it contains the blood vessel, it contains the nerves. Okay, and it is mesodermal in origin. After that, I have written here the pulp, it makes the tooth as a vital organ. Okay, so as the pulp, it contains the blood vessels. Okay, as it contains the nerves. Okay, so that it is one of the vital things that is present in the tooth. Okay, and due to the presence of this pulp, it makes the tooth vital organ. Okay, so we feel the pain. Okay, so when the caries it reaches to the pulp, okay, so it can cause the pain. Okay, so the nerve sensation from the pulp, it is took toward the brain. Okay, so impulses are taken from those nerves that are present in the pulp, so it is the vital organ. After that, I have written here the present of the pulp chamber, that is crown and the root canal. Okay, so we have particularly two parts of this pulp. Okay, one is pulp chamber. So pulp chamber is that part of the pulp that is present in the crown of the teeth, and root canal or the root, okay, it is the part of the pulp that is present in the root side. Okay, so I will show you the picture later. Okay, but just think, pulp chamber is the part of the pulp that is present in the crown, and the root canal, that is the part of the pulp that is present in the root. After that, I have written here the shape of the pulp resembles the shape of the tooth. Okay, so it is sure. After that, total 52 pulp organs. Okay, so 52 pulp organs are present there, 32 of permanent and 20 of the primary. So this is the data you can remember. After that, total volume of the permanent teeth pulp, okay, is 0.38 cc, and mean volume of the single adult human pulp is 0.02 cc. Okay, so this is also data that you can remember, and this is also very important. Okay, so the total volume of the permanent teeth pulp is 0.38 cc, and the mean volume of the single adult human pulp is 0.02 cc. After that, I will discuss with this coronal pulp, and in this coronal pulp, as I have written here, the pulp is present in the crown and it is called the coronal pulp. Similarly, the coronal pulp have 6 surfaces. One is incisal or the occlusal surface, another is a mesial surface that is facing towards the mesial side, another is buccal surface that is facing towards the buccal side, distal surface facing towards the distal side, lingual, and the floor. Okay, so total there are 6 surfaces that is present in this coronal pulp. After that, I have written here pulp horns. Okay, so the pulp horns, they are the protrusion which extends into the cusp. Okay, as I have discussed in my anatomy video. Yes, I remember I have discussed in my anatomy video. There I have discussed with this pulp horns. So pulp horns are just a part of the pulp, especially this pulp chamber. Okay, so they just protrude like a cusp. Okay, in the cuspal areas of the tooth, so they are called the pulp horns. Okay, and protrusion which extends the pulp, and these pulp horns are more, okay, in the deciduous dentition, but they are less prominent in the permanent dentition. Okay, so there I have discussed, and that have some clinical significance. Okay, so when we prepare the cavity, so the pulp is raised earlierly in this deciduous dentition due to this pulp horns. Okay, but not so in that of the permanent dentition. After that, at the cervical region, pulp organ constrict at the contour of the crown and the joints radicular pulp. Okay, so it just constrict and it continue with the radicular pulp. After that, the continuous deposition of the dentine coronal pulp becomes smaller with the age. Okay, so this is very important to understand. Okay, so as with the age, okay, as I have discussed in the dentine chapter, with the increase in the age, there is increase in the formation of the sclerotic dentine. Okay, and there is also a more deposition of the dentine. Okay, so the dentine are formed more with the age, due to which there is a just a covering, there is just a constriction. Okay, so constriction in this pulp, due to which that coronal pulp become smaller and smaller with the age. Okay, and this is very important to understand. After that, in another paper, as I have written here about the radicular pulp. Okay, so radicular pulp means it is the pulp that is present in the root. Okay, so root pulp is called radicular pulp, or the pulp present in the root canals. Okay, after that, single radicular pulp in the anterior but multiple in the posterior. It is so because in posterior there is a multiple roots. Okay, but in the anterior tooth we have just one root. Okay, so that there is a single radicular pulp in anterior but multiple in the posterior tooth. Another point, radicular portion of the pulp are continuous with the periapical connective tissue through the apical foramen. Okay, so the apical foramen I will be discussing here. Okay, but I think you know this apical foramen is just a foramen. Okay, that is present at the tip of the tooth. Okay, and that is a foramen that connects that pulp tissue with the periapical tissue. Okay, so periapical tissue means the tissue that is present around the tip of the tooth. Okay, so that this apical foramen connects that periapical connective tissue with that of the radicular portion of the pulp, and I will be showing the picture. Okay, later. And with the age, with the width of the radicular pulp is reduced, so is the apical foramen. Okay, so the apical foramen width is also, as I have discussed in this paper. Okay, with the age, as I have told here, with the age, okay, coronal pulp becomes smaller. Similar, it follows in the radicular pulp too. And in the radicular pulp also, when the width of the radicular pulp decreases, there is also decrease in the size of the apical foramen. Okay, so radicular pulp, so that is written here. After that, during root formation, apical root end is wide, limited by the epithelial diaphragm. Okay, so during the root formation, apical root end is wide. Okay, apical root end is wide during the root formation, but it is limited by the epithelial diaphragm. And I have cleared this concept of epithelial diaphragm and Hartwig epithelial root sheath in the development of the tooth video. Okay, in advanced bell stage I have discussed with this topic in a very critical way. Okay, so that everyone can get proper concept in this epithelial diaphragm. Okay, so you should just watch that video. During the root formation, apical root end is wide. Okay, but epithelial diaphragm, okay, so that is a bend of the Hartwig epithelial root sheath, it just limits that area. Okay, so you should remember this, and it is very easy to understand and also to remember. After that, I will discuss with the apical foramen, and as I have told here, apical foramen is just a foramen that connects the radicular pulp with the periapical tissue. So it connects the radicular pulp with the periapical connective tissue. After that, diameter in the adult, okay, in the maxillary teeth is 0.4 mm, and in the mandibular teeth it is 0.3 mm. Okay, so you can remember this data. So in maxillary teeth it is 0.4 mm, and in the mandibular teeth it is 0.3 mm. Okay, so in the maxillary teeth there is larger apical foramen. After that, location and the shape of the apical foramen may undergo changes as a result of the functional influence on the teeth. Okay, so this is one of the most conceptual thing as I have written here. Okay, so the location and the shape of the apical foramen, okay, it is dependent on the functional influence. Okay, so what is the proper function? Okay, as we have the tooth. Okay, so the canine have tearing functions. Okay, and incisors have cutting functions, and the molars have chewing functions. So every tooth have different functions, and with their function there is a functional influence. Okay, with their different function. Okay, so that is a functional influence, and that causes the change in the location and the shape of the apical foramen. Okay, after that, I have written here, tooth when tipped from the horizontal forces migrate medially, causing apex to tilt in the opposite direction. Okay, after that, okay, so this is relating with this point. So as I have written here, tooth when tipped from the horizontal forces. Okay, so in chewing forces, okay, when you chew the food, okay, so there is a application of these horizontal forces, and those horizontal forces, okay, cause the migration of the apex, okay, cause the migration medially, causing the apex to tilt in the opposite direction. Okay, so just think, if this is a tip of the tooth and if this is a apex of the tooth, so when we will apply the horizontal force here, so the tip would go in the opposite direction. So the same thing is written here, the migrate medially, causing the apex to tilt in the opposite direction. After that, under the such condition, tissue entering the pulp through the foramen may exert pressure on the wall of the foramen, causing the resorption. Okay, and at the same time cementum laid on the opposite side of the apical root, resulting in the relocation of the original foramen. Okay, so just think, it is very easy to understand. So I have prepared a proper flow chart explaining this point. Okay, so just look here. So as I have written here, okay, so just think this is a tooth, okay, and we apply the horizontal forces here. So with the application of horizontal forces, we can see there is a movement of this apex, okay, in the opposite direction, and with the movement of this apex of the tooth in opposite direction, there is a resorption of this side. Okay, so the side, okay, which is tilting, okay, at the tip of the tooth. Okay, so at that side there is resorption, and on the opposite side there is a cementum deposition, due to which there is a relocation of this apex. Okay, so just think, if there will be deposition of the cementum, okay, on this side, and won't be anything on this side, so the apex that is present on middle, okay, that would come on this side. Okay, so there is a relocation of the apex of the pulp in this pattern. Okay, so the same thing is written here. Okay, so I think you have been cleared in this concept. After that, in accessory canal, so it is also one of the important thing. So accessory canal, okay, many got confused in this accessory canal. Okay, what are they? So just listen to me and you will be cleared in this. Okay, so accessory canals are, they are leading laterally from the radicular pulp into the periodontal tissue. Okay, so it is also a canal, okay, that is arising from the, okay, so just listen to my words, that is arising from the radicular pulp before the apical foramen. Okay, so before apical foramen, as we know that, okay, just think this is a proper tooth and this is apex. Okay, so this, just think this is a root portion, radicular canal. Okay, so radicular pulp is this. Okay, so this is apex. At the end of this radicular pulp there is a apex, and from this apex there is a entering of the blood vessel and exit of the blood vessel. Okay, so there is proper apical foramen present here, but I am saying the, okay, so the area, okay, so the space, okay, that is before this apical foramen. Okay, so there is a canal that is arising from this radicular pulp, that is arising before the apical foramen laterally. Okay, and that is connecting this radicular pulp with the periodontal tissue, that is called the accessory canal. So it is leading laterally from the radicular pulp into the periodontal tissue and seen anywhere but most numerous in the apical third of the root, and it is formed due to the premature loss of the hot epithelial roots or when developing root encounters a blood vessel. And this is important and very critical thing to remember. Okay, so it is so there are two reasons. Okay, so they can ask in the viva, okay, how the accessory canals are formed. So accessory canals are formed due to the premature loss of the hot epithelial root sheath, as I have discussed in the tooth development video. So there is a development of the hot epithelial root sheath from the cervical root. So if, so the hot epithelial root sheath is a two cell layer. Okay, so if it is disturbed in the middle, okay, with any reason, so if there is a premature loss, okay, so if there is a premature loss, as we know that there is a loss of the hot epithelial root sheath. Okay, but if there is premature loss of this hot epithelial root sheath, then there is a formation of the accessory canal, or when the root is encountering the blood vessel. Okay, so this blood vessel just make its pathway to the pulp through this accessory canal. Okay, so there is a proper, so it is sort of adaptation. Okay, so this wall of this radicular pulp just leave this blood vessel pathway and just form the wall around it, okay, that would appear as this canal, okay. So accessory canals are formed in such a way. So premature loss of hot weak epithelial root sheath or the blood vessel, okay. So, and another point, as I have written here, clinically significant in the spread of the infection either from the pulp to the periodontal tissue or the vice versa, okay. And overall occurrence is the 33%, also present at the focusation areas. So this is very important to understand. So this is clinically very important. Spread of infection can be from this accessory canal, and overall occurrence is 33% and also present at the focusation areas. Focusation areas means when the, as in the mandibular molar, okay, so there is a two roots, okay. So the area from where there is a formation of the two roots, so that is called the focusation area, and that is a accessory and there is a accessory canal presence, okay. So now this is one of the most important topics, that is histological zones of the pulp, okay. And in the histological zones of the pulp, so in the pulp there are 4 histological zones, okay. So these histological zones means the zones of the pulp, okay, that is divided on the difference in the histological features, okay. So our first zone is a odontoblastic zone, and odontoblastic zone, the name suggests, so it contains the odontoblast. So it is a most peripheral zone of the pulp adjacent to the predentine. So it is a odontoblastic zone. So it is a most peripheral, okay, peripheral zone of the pulp, and that is adjacent to the predentine. As I have told in a dentine chapter, okay, so the predentine is just a constant layer, okay, and it is an unmineralized layer that is just adjacent to the pulp. And between the predentine and the pulp there is a odontoblast present here there, and from odontoblast there is a arising of the odontoblastic processes, and those odontoblastic processes run in the dentinal tubules of the dentine. So just link everything, okay. So same thing is here, odontoblastic zone. So that zone, okay, so that layer, that band is the odontoblastic zone. After that, odontoblasts are columnar in the crown and flatten in the root, okay. So this is the thing that you can remember, okay. So it is columnar on the crown and it is flattened in the root. After that, cells in the coronal pulp shows a pseudo-stratified arrangement due to the cell crowding. So in the coronal pulp, okay, a pseudo-stratified arrangement is there of the odontoblast, and due to that there is a cell crowding present there, okay. And pseudo-stratified means there is just a single layer, okay, there is just a single layer, and but it appears like a stratified, okay. So it is a false stratified, okay. So the layer, so these levels of the nucleus are different in pseudo stratified epithelium, due to which we think that it is a stratified epithelium, but it is not so. So just remember this. And after that, our another zone is the cell-free zone, and in the cell-free zone, okay, so as it is below the odontoblast, so we call subodontoblastic zone or the Wells zone, okay. So this is another name we can remember. And after that, it is 40 microns wide and relatively free of the cells, okay. So we do not have any kind of cell in this cell-free zone, and it is a 40 microns wide, and it is traversed by the blood vessel, unmyelinated nerves and cytoplasmic processes of the fibroblast. So cell-free zone, it is traversed by the blood vessel, okay. So in cell-free zone we have blood vessel, different kinds of the nerves, okay, unmyelinated nerves, and this is important here, and cytoplasmic processes of the fibroblast, okay. So fibroblasts have different kinds of processes, and that is present here, and it represents the space into which odontoblast move pulpward during the tooth development, okay. So during the tooth development there is a movement of the odontoblast towards the pulp, okay. So this space just, okay, represents the movement of the odontoblast towards the pulp side during the tooth development, okay. After that, in another point, okay, so as I have told here, this unmyelinated nerve is important in this cell-free zone. So there is a presence of the plexus of nerve in this cell-free zone, and that is called subodontoblastic plexus of the Rasco, and this is very important to understand here, and it is demonstrated in the silver nitrate stained section under the light microscope. So under the light microscope, okay, under the light microscope in the silver nitrate staining, okay, we can see this subodontoblastic plexus of the Rasco, and which is the plexus of the nerve that is just below this odontoblastic zone. And after that, there is a seal rich zone or the zone of the Renazio. Okay, so it is also called zone of Renazio, as it is called here zone of Wells or Wells zone. So we can call here this zone of Renazio here. So in the cell rich zone, so the name suggests here we have lots of cell, but in cell free zone we don't have any kind of cell, just we have is the blood vessel, nerves and the cytoplasmic process of the fibroblast. But here we have different kinds of the cell, like a fibroblast is present there, undifferentiated mesenchymal cells is present there. Okay, similarly the macrophages, dendritic cells and lymphocytes are also present in this cell rich zone, and it is formed due to the migration of the cells from the pulp proper, mitosis seen when the dead odontoblasts are replaced. Okay, so formed due to the migration of the cells from the pulp proper. So pulp proper is the core of the pulp, and from the core of the pulp there is a migrations of the cells. Okay, towards this zone, cell rich zone. So it is called the cell rich, so there is a migration of the cells, and mitosis is seen when dead odontoblasts are replaced. Okay, so when the odontoblasts are dead, okay, so there is a mitosis present there. Okay, and which would form the odontoblast there. After that, collagen fiber present in the early dentinogenesis. Okay, so in the early dentinogenesis means the formation of the dentin. So we can see the collagen fibers at that stage of the tooth development or in the dentinogenesis. And now in this pulp core, in the young ones, as I have written here, mold cells are present, but with increasing age there is an increase in the fibers, and the central region of the pulp contains major blood vessel and the nerves. And the pulpal cells and the fibroblasts are seen here. Okay, so pulpal cells, as it is also present in this cell region, it is also present in this pulp core and the most vital portion of this pulp. Okay, so there is a more bundles of the nerve, there is more blood vessel present in this pulp core, so that it makes more vital. Okay, as the pulp is the one of the vital thing that is present in the tooth, and in the pulp itself the pulp core is one of the most vital part of the pulp. Okay, so I have discussed with all those points. Now I will show you a small picture so you will be clear more. So in this picture, okay, so in this picture, okay, I'll just discuss with the proper anatomy. Okay, and I have shown this picture in this my dental anatomy video too, and you can see here, so this red one is the pulp. Okay, so this is a proper pulp cavity. Okay, pulp chamber is present here. Okay, and as I have told, pulp chamber is properly the pulp that is present in the crown. Okay, so this portion, okay, so this is a symmetry-enamel junction here, and above this is a crown here, and this is a pulp chamber, and below that there is a radicular pulp. Okay, and this radicular pulp is ending at the apical foramen here, and from this radicular pulp there arise a radicular accessory canals. Okay, and that is connecting this radicular pulp with the periapical connective tissue. Okay, so this is of the anterior tooth, and in the posterior tooth we can see here, so this is a radicular pulp. Okay, and here is no presence of the accessory canal, they are not showing that here, and we can see the apical foramen here, and okay, so there is a constriction. Okay, so this is a pulp chamber that is constricting here, and again forming the radicular pulp here, and this is a pulp chamber here that is present in the crown. Okay, and this is junction between the root and the crown. Okay, so this is a radicular pulp, this is a coronal pulp, and this is a apical foramen. Okay, and this is a accessory canal. Okay, so I think you will clear in this concept now. And now I will show you the another picture, and this is a histological picture. Okay, so in this histological picture I want to show you that, okay, so this is a predentin layer. Okay, and this is a dentin. Okay, so there is dentin, and then there is a predentin, and then there is a odontoblastic layer, and from here this odontoblast there starts the pulp. Okay, so this is the area of the pulp, and this is the area of the dentin, and this white. Okay, so you can see here this white layer. Okay, that is crossed by the odontoblastic processes, and that is a predentin, and this is odontoblast here. Okay, and below the odontoblast we can see the cell-free zone. Okay, so the cell-free zone, there is a nerves. Okay, and there is a presence of the blood vessels, and also there is a presence of the cytoplasmic processes. Okay, of the fibroblast, as I have discussed earlierly. So those nerve plexuses that is present in this cell-free zone is called the subodontoblastic plexus of the rasco, and after that we can see here there is a cell rich zone. Okay, so lots of cell we can see here. Okay, and this cell rich zone, okay, and it is also called the zone of Renazio. and after that cell rich zone we can see the pulp core. Okay, so in the pulp core there is a presence of the blood vessels, nerves, and different kinds of other cells. Okay, so it is one of the most vital part of the pulp. Okay, so I think now you are clear with the concepts of this pulp, and in the next video we will discussing with the pulp other topics of other subtopics of the pulp. Okay, so this much for today, and if you love this video please do like, subscribe, and share with your batchmates, and I'll meet you in the next video, part 2 of this pulp. Till then, stay happy, stay healthy, and tata bye bye. Thank you.